Being prescribed a new drug or medication can be really scary to start taking. Even if you trust the doctor or the physician who prescribed it, there are so many blogs online, so many personal antidotes, and so many side effects on that prescription label that it can feel terrifying. And if you're sick, you're prescribed something to get better. But seeing all of these other things makes us wonder, is this going to make me worse? Today, I want to talk about these 7 questions that I think that every patient should ask their doctor if you're concerned about taking a new medication. And truth be told, the doctor probably won't have the answer to all these. The reason why is because some of these questions are pretty intensive. You might have to ask the pharmacist, the person who's actually at the pharmacy, and you might even have to, explore and find some experts or read some medical studies if you really want the answer to every question. But I'm gonna leave all 7 of these in the comments or in the description below so that you can bring them to your doctor. And I think that it's, a healthcare provider's obligation to quell the fears or to explain the decisions that they're making so that as patients and as consumers, we can be educated and informed and take our health into our own hands along with the care of a provider. And the first one is, what is this drug originally designed or useful for? This is really important because sometimes drugs are used off-label. A really good example of this is birth control and acne. A lot of people who have acne get put on birth control, not because they actually need birth control, but because birth control can impact hormones, which can help people who have acne. And when I was going through acne, this wasn't an option for me because of my parental situation and my personal choices. But I was just given antibiotics after antibiotics after antibiotics, and I didn't ask a lot of these questions. And I feel like if I had had some of these back then, I wonder if my course of treatment would have been better or I wouldn't have dealt with stomach swelling. Antibiotics are necessary, especially if you have an infection, but more and more increasingly we're seeing them not used for acne patients because of some of the reasons that I went through. But ask what the drug was originally used for. Even Viagra, we know that is like, a men's happy pill. Is it men or women? I think it's only men. Used to be a heart medication. And they just found off-label uses for it. Spironolactone is another one. It's a diuretic, and it can actually help with high blood pressure. But some people use that in the treatment of acne. And I think it's important to know because if you're taking birth control, you're gonna have the effect of birth control along with the acne. If you're taking spironolactone, you're going to potentially get a blood pressure lowering effect or a diuretic effect along with your acne treatment. So that is something to be informed of. The second is, how does the target population different from you? And this is something that the doctor might know. You might have to go to the pharmacist, or you might actually have to look at the drugs, some of the pharmaceutical studies. And the reason why is because when drugs are tested, usually clinical testing goes through many different trials in many different phases. Unfortunately, it usually starts off in animals, but then they actually test people in different levels of health or sickness. For instance, a drug is going to work very differently on me if I'm healthy and normal versus somebody who is sick, who has high levels of inflammation, maybe has just battled cancer or disease. Something that would not even impact me might make a huge amount of help for them. Or a virus that my body would normally fight off might kill somebody who's immunocompromised. And it's really important to know the basis that the studies were created off of, especially because in some medications and in some therapies that aren't necessarily patented, a lot of these tests are done in humans, but a lot of them are done in just men. And men and women do, outside of gender identity, we do have, different chromosomes, and those chromosomes impact our bodies differently. And the functioning bodies are actually going to be somewhat different. And even the brain structure and even how we use T helper cells when it comes to fighting inflammation or promoting inflammation. And if we don't know who the population group that this drug or this therapy was tested on individually, how do we know if it's going to work on us? You always see, don't feed this to children, or this is fine for children, adults take 3 times the amount. You want to know who that was tested in originally so that you can have the best idea of what your outcome is going to be. And if it was tested in healthy populations and you're in a sick population, that could be very, very different. This one seems so self-explanatory, but nobody ever seems to ask this, and I never asked this. But what is the effect we're trying to get? Right? Obviously, for certain things, if you're sick, you want to get better, but let's actually quantify, what does better look like? How will I know if I've gotten better? Let's say that I have severe chronic cystic acne and I take a new medication. Is better a reduction of 99% of my pimples? But if I still have one pimple, do I then freak out and say, I wasn't fixed? So what is better? And for me, when I was going through antibiotics and things, lots of medications weren't helping at all. But the doctor was saying, well, even though you still have a ton of blemishes and a ton of breakouts, they're a little bit better on your chest area. So therefore, that's improvement, and we're gonna say that this was fixed. It's like, no, still puking up blueberries because I took minocycline and it made me feel sick, and now my stomach is swollen and I've still got pimples here, which is where it's bothering me. So have a goal, have an objective, and know what you're actually going for. The next one is, what is the mechanism of action and where will this have an impact in my body? Our cells are amazing and they have so many different receptors on them that just because we take one medication doesn't mean it's only going to work in that one place. Let's say that I'm stupid and I ran into a wall, stubbed my toe. My toe is in pain. I'm gonna take some Advil, right? And NSAID, I'm gonna take that Advil to get me some pain killing. Well, that Advil doesn't just target my toe. Yes, it makes the pain feel better, but it's actually working all throughout the body. It doesn't go exactly to the toe. It's just the toe that's hurting, and it blunts the pain everywhere else. So if I slammed my arm into a chair, maybe my arm would not hurt as bad if I'm already on the Advil. So it's important to know where these drugs, chemicals, or compounds are actually helping you or impacting you in the body. And then you also want to know the mechanism of action. And that basically means how it does what it does. For example, a serotonin reuptake inhibitor, SSRI, is used in depression. Our brain sends chemical signals, and the way that it does that is through a special place called a synapse. You can kind of think of it as like two fists, and then there's space in the middle. And this is where neurotransmitters get sent. Think of them as like glitter. One fist shoots glitter into the other fist, and that's how they communicate. Our brains are cool, right? Well, serotonin reuptake and selective serotonin reuptake inhibitors used to be used a lot in the treatment of depression. And it's the idea that the glitter makes us happy, right? But for people with depression, the glitter doesn't hang around as much. It doesn't always connect from part 1 to part 2, or it doesn't stay there long enough. So this drug goes in and it's selective. It only works in this one junction, and it only works on serotonin, and it keeps the glitter in there longer, the neurotransmitters in there longer, so that they can actually do their job better. And because serotonin is related to happiness or an elevated mood, it's supposed to help people with depression. Now that's very selective, but what if, like Advil, that started happening elsewhere in the body? And you also want to know how that happens, because what if your body's different? I don't know, what if this is a drug that's working on a specific gene or, I don't know, a specific pathway in the body, and yours happens to be a little bit unusual? You would want to know about that stuff. And most general practitioners don't have this kind of information, but you can ask a pharmacist, and they should be able to tell you this kind of stuff. But that's something you want to know. Also, serotonin, in our brains, it's a neurotransmitter, but this isn't where it is mainly in the body. It's also found in our gut, in our stomach. And in our stomach, it actually acts, I think, a little bit more like a hormone. And so and it's produced by bacteria, actually. But that's so interesting, because something that works so differently in our brain can't even get out, and it can't go through what's called the blood-brain barrier. There's a barrier that protects our brains. Our brain produces it, and it has one function here, but the same molecule is produced elsewhere in the body and has a completely different function, which to me is just so cool. But it also shows you that this same compound could be totally different in other areas of the body. 5-hydroxytryptamine, by the way, in case you were curious. A little notes here. This, of course, this next one is something that your doctor should talk to you about. But my doctors didn't talk to me about this 100% of the time, and that's just the way it is. But interactions with other drugs. And the reason this is important is because I want to know if spironolactone is going to give me the runs. But at the same time, if I am taking a drug like birth control for an off-label use like acne, am I taking other acne medications that have maybe never been tested with birth control? Or am I taking other acne medications that have never been tested with a diuretic like spironolactone? And these drug interactions are really, really essential to understand because these are powerful substances that are there to help you, but you don't want to make them useless or make them work too well or do something bad inside the body. So the pharmacist would probably know this better than the doctor, but it is the doctor's responsibility to have this conversation with you. The other questions that you want to ask are, how does the body get rid of this compound? For instance, does this get pissed out? Like if I take too much B12, does it get stored in my tissues or will I piss it away? Or biotin, if you take too much biotin, which is a B vitamin, your body doesn't use it or store it. It pisses it out, right? Alcohol metabolism, does that happen in the liver? Is it also happening at like 0.3 or 0.5% through respiration? Is this detoxed by my liver? What is the way that the body is going to get rid of this? And guess what? If you have one kidney, maybe your kidneys aren't filtering things out as well. And guess who happens to have one kidney? And none of the doctors really spoke to me about this. And I, until I started studying, never even thought to myself, wow, I could have been taking levels of medications that were dangerous, if not harmful for me, because my one and only kidney could not excrete things the way it needed to, which is, something very interesting to think about, especially if you have a special body or you got one kidney. The last question you want to ask are about the side effects and the short-term and long-term effects. For instance, I was on 1,200 milligrams of tetracycline, which is an antibiotic. Didn't think that it would make me as nauseous as it did. Didn't think that it would cause my teeth to actually get yellow or photosensitive, but it really did. Those were things I was semi-prepared for. Never expected the weight gain, never expected the stomach swelling, never expected the internal bleeding. Again, didn't expect the other side effects as heavily as I thought. And I was put on that originally, it was supposed to be like a month or two. Ended up being on it for 8 months to a year. And that's kind of dangerous because the short-term effects are very different than the long-term effects. And you have to know, like, does the doctor plan to keep you on this forever? And then why this really matters is because you have to balance your outcomes. For myself personally, tetracycline, minocycline, doxycycline, those were like the 3 antibiotics that doctors always tried to put me on for my acne. And it's true, they can kill bacteria, and they made slight differences in my skin, but nothing really helped. And for me, the side effects were horrific, to the point that I was puking blueberries on the freeway in my grandmother's car, and I could not drive safely. And I felt so sick every day. I couldn't even go outside during the daytime because my skin was so sensitive. It was horrible. But if I would have known about the side effects or how to balance them, maybe I could have spoken with a physician earlier on taking Bactrim or topical options, like Tazorac cream or clindamycin phosphate lotion, or these other options that wouldn't have the same side effects. And I think that regardless of what medication you're taking, you need to know not only the side effects, but how to balance them. If you go to the doctor and you have a runny nose, maybe they're gonna want to prescribe you a prescription. But if this is not a life or death situation, shouldn't you be able to weigh the risks and balances? Like, balance the risks. If there is no risk, fine, take it. But if there's the risk of a urinary tract infection or like internal bleeding, probably don't want to take that, right? And I think that doctors are quick to prescribe things because they don't want to get sued and they want to take care of a patient well. But sometimes you should seek a second opinion, or you should talk to the pharmacist about that, because there might be another option for you. Now, of course, if you're in the case of having a flesh-eating bacterial infection or like a staph infection like MRSA, you're gonna wanna take your antibiotics, you're gonna wanna take all of them, because any of those side effects are more important than your life. Your life is more important than any of those side effects. But do you see how, like, for a runny nose, that could be different? And this is where Accutane gets really, really interesting, because there are some side effects. There are some long-term implications we are not aware of when it comes to synovial joint fluid and cerebral spinal fluid, but most people who are on Accutane have debilitating acne. And the question with Accutane becomes, if this acne patient is so depressed that like they're ready to commit suicide, is it worth it to give them Accutane to make their life dramatically better? Because Accutane has been proven to work, you know, and not everyone experiences side effects, but is that worth it? The drying, the pain, the constant birth control checks because it can cause fetal development issues. Is the patient at a point where they need that? Or is this someone who has 3 pimples and complains about a breakout, and really those side effects would be very negative for that person? Those are things to think about. And again, the doctor might not know this. You might have to ask a pharmacist. You might have to ask a specialist. You might have to go on try to understand some medical papers. And if you don't have a background in reading medical research, I understand that can be hard, but really just ask. And sometimes even the receptionists at the doctor's office can point you in the right direction. And the truth is that, like, dude, it's terrifying. I went through so much when I was on prescriptions, and I haven't taken prescriptions in quite a while now, but for topical medications, for oral medications, it is very, very scary. Now, there's also so much BS online that there is fear-mongering that can make us really reluctant to take a treatment or a medication or a therapy that could help us. But again, all of these different questions are going to be very different for each and every single person. And that's why I'm going to link them in the description below. And if you're nervous, I want you to ask the doctor, physician, or pharmacist about these. There's another video here about some of my thoughts on acne and diet-related things that don't involve medication. And there's another video here on acne that you might find reassuring. If you have acne, you have to watch this. Remember to be beautiful inside and out, and I can't wait to see you tomorrow in the next video. Love you guys. Bye.